Thank you. Kevin Kavanagh from HealthWatch USA. I would like to urge the HICPAC to expand transparency initiatives for infectious disease and encourage the rapid reporting of outbreaks of dangerous pathogens. I can only imagine the pressure that the CDC is under to mitigate numbers and even maybe to inhibit release of data. But as reported in a historical review, The Pandemic Century, many nations, including the United States, have been guilty of this. For example, in the 1924 plague epidemic in California, the word plague was not used in state newspapers, and instead, the illness was referred to as a malignant form of pneumonia. There was poor communication between agencies, and state officials only became aware of the outbreak through the news media reports. In the 2002 SARS epidemic, which originated in China, the Chinese government withheld the number of cases and critical information, which inhibited the realization that medicine was not dealing with the flu, but instead a more dangerous coronavirus. In the 2014 Ebola epidemic, the government of Guinea insisted that only laboratory-confirmed cases be reported in a country which had very meager healthcare and testing resources. This resulted in a vast underestimation of cases, a perception that the epidemic was on the wane, and an inhibition of resources. And this, of course, fueled the spread of Ebola to other nations and making it a world crisis. Specifically in the United States, Candida auris and CRE are organisms which pose extreme dangers both nationally and internationally. The WHO International Health Regulations of 2005 may well enable the CDC to mandate public reporting and oversee control of these pathogens in any state with an international airport or seaport. We do need greater transparency in other areas. The CDC needs to publicly release infection control data regarding MRSA infections, which are defined as community and occur within the first 3 days of hospitalization. The CDC should also gather and publicly report information regarding healthcare worker infections and acquisitions of dangerous pathogens, including MRSA, and require routine testing of those workers exposed to dangerous pathogens. And at a minimum, facilities should be required to maintain a log of healthcare worker acquisitions and infections of dangerous pathogens. MRSA and C. difficile infections of all types of nursing facilities need to be reported. Any MRSA positive culture or acquisition at a nursing facility is of importance. Wong et al. In New England Journal of Medicine article this year reported that carriers are at risk of future infections and that many of these can be prevented. In conclusion, we need to focus on actual numbers of infected patients and driving these numbers down through increased implementation of preventive strategies rather than mathematical adjustments. Thank you.